So Vanessa and I have transsphenoidal hypophysectomy. It's the excision or destruction of all of the portion of the pituitary gland. The pre-op diagnosis for this procedure would be the endocrine disorders, primary tumors, or pituitary, some presentations of diabetic or retinopathy, metastatic breast, and prostatic carcinoma. The position the patient would be in would be supine, making sure that arms are padded and tucked at the patient's side. For the skin preparation, 2 prep sets are required. Determine the type of solution to be used in the area to be prepped. The area may include the face or oral and nasal cavities. Add to the prep set for the face include a bayonet forceps, nasal speculum, long cotton-tipped applicators, medicine cup, and hemostat. Do not permit the prep solution to run into the eyes. Eye elements, eye pads, and shields may be placed. Do not permit the solution to the pool in the ear. Place a cotton plug in the ear. The circulator or the surgeon removes the cotton with the hemostat prior to the draping. Sterile towels or lap pads may be placed on the neck on either side and carefully remove at the conclusion of the prep. Dries the skin in the skin prepped area. Prepped areas must be dry or the adhesive drape will not stick. The second prep set is for the graft site. The graft site may be taken from the thigh, begin at the groin, extending prep to the level of the iliac crest on a designated side, down to the knee and to the table on the sides. When the graft is taken from the anterior abdomen, the prep extends from the nipple line to the groin and down to the table at the sides. The draping of this procedure, a large drape sheet is placed under the head. Towels are placed around the periphery of the patient's face and intended side of the incision for the graft. A sterile plastic adhesive strip is placed over the face and another may be placed over the exposed thigh, taking care not to contaminate either sterile field or craniotomy sheet with a plastic insertion. It may be placed on the face. A large sheet covers the upper part of the body. The graft area of the thigh is draped with folded towels, a plastic adhesive drape, and additional drape sheets. A towel may be placed over the face until access is needed. Drapes are also needed for the C-arm image intensifier and the microscope when used.
So for this procedure, a transnasal or a sublabial incision can be used for a rapid access to the sella turcica. A sublabial incision would be made in the middle of the upper gum margin, but more recently an endoscope has been used through a transnasal route to avoid an incision. Anatomy that we'll see through this procedure will be the nasal septum, nasal mucosa, sphenoidal sinus, hypophyseal cavity, the nares and the sella turcica, and the pituitary gland. So the surgeon may take a small piece of muscle from the previously prepped thigh or a fat graft from the abdomen to be used later in the procedure. After the sublabial incision has been made, the soft tissues of the upper lip and nose are elevated from the bone with an elevator and the nasal septum is exposed. The nasal mucosa is elevated from either side of the nasal septum, which is flanked by the blades of the Cushing bivalve speculum. The inferior third of the anterior cartilaginous septum and osseous femur are resected, as is the floor of the sphenoidal sinus, exposing the sinus cavity. The surgeon opens the floor with a sphenoidal punch and incises the dura mater. The extracapsular cleavage plane is identified and the superior surface of the pituitary is dissected until the stalk and the diaphragmatic orifice are found. Pledgets are placed for exposure, hemostasis, and protection. Using a sickle knife, the surgeon sections the pituitary stalk and uses an enucleator to dissect the lateral, posterior, and inferior surfaces of the gland. The gland is removed and the sellar cavity may be packed to prevent CSF leakage. The packing is accomplished with muscle obtained previously from the thigh or with the fat graft that was previously obtained. The floor is then reconstructed with cartilage from the nasal septum. 3 examples of equipment that we'll use throughout this procedure is a sickle knife, sphenoidal punch. The C-arm may be used to verify the anatomic location of the sella turcica. Some risk factors that are involved with this procedure are the cerebrospinal fluid leakage, hypopituitarism, and diabetes insipidus. So our question to you guys is, what are the pledgets used for?